My name is Henri Timmers. I'm an internist endocrinologist. I'm a full professor of endocrinology, and I work in Nijmegen in the Netherlands at a center called Radboud University Medical Center. And I am the chair of the Radboud Center of Expertise for Adrenal Diseases. So the adrenal glands are small glands that are on top of both of the kidneys. They produce cortisol and other hormones, and these hormones are really essential for the body's response to stress, also to maintain your blood pressure, to maintain the blood glucose. And when you have an adrenal insufficiency, this is a condition where the adrenal glands no longer function properly and the hormones are no longer produced. And this basically, in severe cases, leads to a total shutdown of the body. There's different forms depending on which organ is affected. If the adrenals themselves are affected and fail to produce hormones, it's called primary adrenal insufficiency. When there's a problem with the pituitary gland, that it's a small hormone producing gland that sits below the brain and stimulates the adrenal glands. If there's a problem there, we would call it secondary adrenal insufficiency. And we also have a third form, the tertiary adrenal insufficiency, and that's when there is a problem with the hypothalamus. That's a structure that sits within the brain and stimulates the pituitary gland. So there's 3 levels of regulation of the adrenal glands. Adrenal insufficiency, there's a lack of adrenal hormones, such as cortisol and sometimes also other hormones. And this can lead to really a variety of flu-like symptoms. And this includes fatigue, it includes muscle aches, can lead to nausea and vomiting, but also to fatigue and sleepiness. And the way adrenal insufficiency is diagnosed is by measuring cortisol and other hormones in the blood, preferably. This is preferably done in the early morning when normally cortisol reaches its peak, its highest peak during the day, because cortisol normally decreases during the day and is very low during the night. And sometimes besides measuring cortisol in the blood, it can be necessary to do a stimulation test using, for example, ACTH, that's the hormone that comes from the pituitary gland and stimulates the adrenal glands. Stimulation can also be done by insulin or by an agent called methyropone. And what you typically would do is look at the cortisol increase in response to these stimuli to see whether there is a maybe less severe form of adrenal insufficiency. Under normal circumstances, the adrenal glands produce a fixed, let's say, dose of cortisol. And this is the same when you have adrenal insufficiency. It is usually sufficient to use a fixed dose of cortisol replacement. Usually this is hydrocortisone or another steroid. Usually the dose is divided in 2 or 3 times a day. For some patients, it's enough to take 1 dose in the morning. For others require 4 times a day dosing. Most people, it's sufficient to take 2 or 3 doses a day, typically with the highest dose of hydrocortisone in the morning. And this is to mimic a normal diurnal rhythm where there's the highest cortisol peak in the morning and a gradual decrease during the day. But under special circumstances, when there is stress, for example, when there's fever, when you have a flu, or when you have, for example, pain, then normally your adrenal glands would produce more cortisol. And when you have an adrenal insufficiency and you rely on oral supplementation of hydrocortisone, it's very important to increase the dose, double the dose or triple the dose to meet the level of stress and the extra requirements of steroids in those situations. We call this stress dosing, and we also have a term sick day rules, where you need to be aware that during illness you need more hydrocortisone. And this is all to prevent a situation called adrenal crisis. That's basically the shutdown of the body due to insufficient adrenal hormones. And this is potentially life-threatening. So it's very important that when the body has a higher requirement of cortisol or hydrocortisone, to increase the dose. Sometimes it's no longer possible to take hydrocortisone orally, for example, due to vomiting. And then it's very important to be able to self-administer or have your peers administer hydrocortisone through an intramuscular injection to make sure that your body gets enough steroids to overcome the stress. And sometimes it's also necessary to go to the emergency room and be admitted to the hospital to get proper dosing of the steroids. There are some misconceptions about the function of the adrenals, in the sense that you will find in many websites and social media a term adrenal fatigue. And adrenal fatigue should definitely not be confused with adrenal insufficiency. Adrenal insufficiency is a real medical term where your adrenal glands don't function properly anymore, whereas adrenal fatigue is basically not a medical term. It's a concept where it is suggested that due to stress during life, for example, a demanding job or problems in your family, where your adrenal glands are basically drained and kind of worn out. And the idea is that your adrenal glands get worn out due to increased stress. But this is really different from adrenal insufficiency, because with adrenal fatigue, you actually have high cortisol levels. So the problem is not necessarily a shortage of adrenal hormones. And the solution to the problem, and this is sometimes suggested by websites, is that the solution is definitely not to take extra steroids. Extra steroids will actually be harmful and can give side effects, and this should be avoided. So adrenal fatigue really is something really different, and it's basically a layman's term. It's not a medical term. Adrenal insufficiency is a chronic disease. And I have to say, most patients I meet with adrenal insufficiency can have a good quality of life, and this is true for the majority of the patients who have this condition. On the other hand, the patients themselves and also their caregivers, their peers, they need to constantly be aware that they have this chronic disease, and that in case of extra stress, physical stress, let's say severe emotional stress, it will be very important to increase the hydrocortisone dose to prevent adrenal crisis. So this is something definitely to always be prepared of. We also know that with hormonal supplementation, we do a pretty good job in overcoming the shortage of the adrenal hormones by supplementation of hydrocortisone. But still, it's never exactly the natural situation, so to say. Some people do experience chronic fatigue or limitations in their physical exercise, for example, due to the fact that it's not completely possible to completely mimic the natural production of cortisol by supplementation of hydrocortisone. So some people definitely do experience, despite excellent supplementation, chronic signs and symptoms, unfortunately. I think it's very important that when you're dealing with adrenal insufficiency, either yourself or as a caregiver or as a peer to the patient, it's very important to be very well informed. Self-education is really very important. And it might help to join, for example, a support group or a patient organization to be really up to date on what can be the impact um, of adrenal insufficiency on your life, and also to be very well instructed, very well educated on how to deal with adrenal crisis. So how to deal with self-management regarding increasing your dose according to the sick day rules, be instructed well on how to self-administer, for example, cortisol emergency injections with hydrocortisone. Also, it can help to carry, for example, an emergency card so that when you're not able to express your condition, to inform the people who find you, the caregivers, people from the ambulance, etc., so that they find your emergency card or your emergency bracelet and see that you are suffering for adrenal insufficiency, to make sure that you are properly handled, get your stress dosing of hydrocortisone. This can be through an injection, for example. And what I think is also very important is to have your regular checkups at, at centers of expertise for adrenal insufficiency, like, for example, our Radboud Adrenal Medical Center in Nijmegen, the Netherlands.